Kidney biopsy has come back. And while we did think it was an acute kidney disorder, it ended up not being. It ended up being a combination of diabetes, FGS, which is scarring in the kidney, and vascular damage. So, diabetes would not typically cause your kidney function to go down, 80% in 2 years. That's just crazy. However, when you combine it with FGS, which is the scarring, and the vascular damage, it's like fast forwarding it 20 years, 25 years. So while some people with diabetes, it may take them 10 years, 20 years sometimes for their function to come down. Mine came down in 2 years because of these things combined. So what are the next steps? Well, we got a meeting with our doctor in 2 weeks. And at that point, we will focus on preserving as much kidney function as I can. Right now, that's at about 30%. When I get down to about 20 is when we'll start having conversations of getting onto the transplant list. When I start getting down to 15, then that's when we start looking at going on dialysis. Now, how long is it going to take me to get to that point? Nobody really knows. But all we can do is look at trends. And if the last 2 or 3 years, those trends have shown us even numbers that are controlled, like blood sugars and high blood pressure, which are big things on controlling this. Even with those things being controlled, the massive downward spiral we've seen could be 6 months, could be 12 months, could be 18 months before we hit dialysis. Nobody really knows. We just have to focus on preserving as much as we can. Then looking at in-center dialysis versus at-home dialysis, getting on the transplant list, finding a living donor, is the best option there. One reason is because when it comes to kidney transplant success rates, it's a much higher rate with a living donor than it is one coming from a deceased donor. So this is exactly what we're looking at now as we move into these next steps. As I start to meet with a dietitian to balance out my diet for balancing my blood sugar and protecting my kidneys. So we'll see what the next steps are after this. But this is exactly what the biopsy showed us and what our next steps are as a result of the biopsy. I hope everybody had found value in this video. Do me a favor, hit share, subscribe, and like the channel if you provide value in this. If someone else you know is going through this experience, share their video with them. Because the goal of my journey with this channel is to be able to help others as I go through this process. Thank you.